Hello, I'm Britt Carlson for Oroville Hospital. Today we're talking and learning more about the Hospitalist program here at Oroville Hospital. Today I'm joined by Dr. Larry Seaman, who also happens to be director of the Hospitalist program. So first, give us a little breakdown of what the Hospitalist program entails here at Oroville Hospital.
Well, the Hospitalist program, which has been here since about 2003, is a dedicated program where we totally take care of patients in-house. We have no outpatient responsibility whatsoever. Patient comes in, they are admitted by our Hospitalist program. We follow them through their entire stay. We have physicians who are dedicated only to that. They are organized in teams, and they see 14 patients, 15 patients a day, which are their responsibilities. And with that, they're available all day long. They can come talk to the patient, they can talk to the family, they interact daily on a regular basis with nurses, lab, x-ray, whatever it takes to develop a good care program for the patient and get them out well, healthy as we possibly can.
Give us an idea about how the Hospitalist program has evolved at the hospital. It wasn't always like this.
No, for many years, like every hospital in the United States, this hospital had a group of private physicians, some of them integrated, some of them independent, who would come in and see a patient in the morning, go to their office after that, come back at noon, see a patient, go back to their office for a few hours, come back in the evening, see a patient, go home, maybe be on call, maybe not be on call. That was becoming a big problem in modern medicine. So the hospital concept developed where there is an in-house in the hospital physician, care provider who is there 24/7. And we, in 2003, started that program with one or two physicians and have now evolved where we are now, where we have 100% of the patients in the hospital, except for, again, pediatrics and the OB patients. They are cared for by the pediatricians, obviously, and obstetricians. But we now take care of everything 24/7. We are integrated with the surgical services. We are integrated with cardiology, GI, pulmonary, all the subspecialty services.
All right. So what is a day-to-day look at what a hospitalist does?
Well, our Hospitalist program, we start about 6:30 in the morning, and we meet together. We go over the night's admissions with the nocturnist, who's our nighttime doctor. We then spend another 20 or 30 minutes going over the discharges for the day. We get a surgical report from our surgeons who have come in. They are also integrated with our program. We talk to cardiology, pulmonary, the other subspecialists that come in. The CEO of the hospital is there, gives us sort of a state of the hospital report, if you will, or if we need to talk to him about issues that have arisen in terms of patient care and quality of care, we have a moment to speak about that. We also have our chief medical officer, our chief information officer, both of whom either bring us up to date on changes in our medical record or types of quality of care. Chief nursing officer. So it's an integrated meeting where a lot of information is presented on hospital operations, patient care. The ultimate goal is to deliver efficient, high-quality medical care to our patients and get them at home in a safe fashion.
And how do you think that has improved the overall care of the patients?
Well, it actually has allowed us not only to improve patient care, improve the communication, but the other thing it's done is there's a lot of performance grades out there, and it's allowed us to score very, very high in our health performance grades. We've eliminated a lot of errors that were unfortunately there before in patient care, because again, we're meeting constantly, we're talking constantly, we meet with our chief medical officer constantly. Matter of fact, he's in rounds 5 days a week with us too.
Okay, well, it sounds like a great program. If a patient is interested in learning more about it or maybe speaking one-on-one with their hospitalist, how would they do that?
The easiest way is to talk to their nurse who's taking care of them. They can get a hold of us, they give us a phone call, or talk to us right there at the desk where we're working. We will go in and talk to the patient.
All right. So thank you for being here with us today.
You're welcome. Thank you very much.